Hi, everyone. Good evening. Thank you for joining us today. I'm Marina Penn. I'm co-founder of Nabi. I'm here with EJ Kim, who's my other half on Nabi. And we're very excited to have this session today and have you join us. We're here to talk about perimenopause and things that happened during perimenopause. This is Perimenopause Awareness Month. And I am recording, Rachel, but that's fine if you need to record as well. And we are co-founders of Nabi. Nabi is a wellness company specifically focused on perimenopause. And our goal is to redefine how women go through perimenopause through natural products, through education and building community, which is basically why we're doing these webinars and sometimes IRL meetings in New York. And this is how we met Rachel, and just talking and discussing things that happen during perimenopause, sharing our own experiences. Personally, just like sneezing has been an issue lately. So I'm really hoping Rachel can share some of, tips about how to train our pelvic floor and, make it stronger. And then also talking about sexual health and sexual wellness during this time, because we do know that it's so important. And there's several symptoms that impact our sexual well-being during perimenopause. So we're going to introduce Rachel in a minute, but just wanted like quick PSA for this group. The information that we're sharing here should not be taken as medical advice. This is just educational and should be taken as such. And if you have any questions, you should speak with your physician. And if you have any questions throughout this conversation, please feel free to drop them on the chat, and we're going to pause and ask those questions, or even hold up until the end and ask those questions to Rachel. And as you might have noticed, we're going to be recording this session, and we're going to be sharing the link afterwards if you want to rewatch, or even for people that have not been able to join tonight that are able to watch it. And as well, you can share it. So EJ, I'm not sure if you want to take it from here and into Rachel. Yeah. Thank you.
Yeah, let's do it. Thank you for the setup. And, what we love about this kind of session is that we tend to get anywhere from 10 to 20 people. And then sometimes this like groups that we have right now is very intimate. And I think the fact that we're talking about pelvic health and sexual wellness, I think there's a lot of perhaps conversations and stories. So we may encourage you guys to share your story throughout the chat. So, don't be shy. It's a safe group here. So really excited to, have this dialogue. Let me introduce our speaker, Rachel. So you guys know who this person is as a starter. So Rachel Williams is a founder of Midtown Physical Therapy here in the city in Manhattan. And she has a master's in physical therapy from Columbia University, and she has a passion for treating chronic pain, pelvic health, and supporting patients through perimenopause. She pioneered this human touch therapy. We're going to hear a bit more about that later, but to promote balance, wellness, and healing. Again, excited about to double click that. And she's very much committed to personalized care, continuing education, and bringing years of expertise to her patients, and really thrilled to have her. She is a lifetime New Yorker. So that's something that we actually also connected. Not that I'm a lifetime New Yorker, but I feel like I lived here long enough that, I bounce really well with the people who are very New York. And straight shooter, she tells you like it is, but, she means well, like that's her. And she's also, as a woman, once I got to know her, what's been really inspiring is throughout this Nabi project, we meet a lot of people, and a lot of us in Peri, like Marina, myself in Peri, and I think a lot of you who are here probably in Peri as well. And Rachel, she's in Peri too. She also went through a stomach cancer, rare kind of stomach cancer, and she told me that it was okay to share that, for past 2 years, she's been, clean. She said that she's been in best shape ever. So she can maybe tell us a little bit more about her journey. And, she really understands this journey that we're going through, not from a professional standpoint, because she does see a lot of patients, perimenopause and pelvic. And so That's her sort of expertise she's bringing, but herself as a woman going through it. She also told me that she's a vivid poker player. So if anyone who really likes to play poker, maybe you guys can connect afterwards. So Rachel.
Hello, thank you
Hello,
so
hello.
much. I thought we weren't going to tell people about me playing poker.
Well, I thought about it. I was like, well, if there's someone who's like fascinated by it, right now, because we want to bring this as a more of like, us getting to know each other too, right? So,
For sure.
but yeah, so want to kind of jump in. This is a little bit of Q&A style, guys. So Rachel, I want to start with your experience with Peri. Obviously, this is a personal topic.
Mhm.
So why don't we start with you talking about your personal experience being in Peri, as
Okay.
well as seeing patients in Peri that you're
Mhm.
helping. So like, what do you know about Peri, and what does this topic even mean to you? How does this matter to you personally and professionally?
Mhm. Well, I think that's a great place to start. And I think it's really interesting because even though I am a healthcare provider and I see pelvic health, sexual wellness, it was still really an interesting journey for me I because perimenopause has so many broad symptoms. It's like, I think the list is what, 35, 38 things. It starts at such a wide range of ages that I didn't even know myself really well, am I in it? Am I not? And around the same time I got diagnosed, I was sick and I had cancer. And a lot of the same things, like, getting hot at night, mood changes, not feeling well, digestive issues. There were so many things that were like crossed over that I don't know for me if I could ever define a moment and say, yes, I'm in perimenopause. Just like when we go into menopause, there is that defining moment, right? It's that one day, 1 year after you do not have a period, right? Then you go from menopause to postmenopause. That's the defining moment. And I think that everything else is kind of just this cycle that fluctuates, and it could start at different ages, right? As in your 30s, it can start in your 40s. It can have crossover with a lot of other things. So I think that that's kind of the elusive part about perimenopause, menopause is A, nobody talks about it, and B, it's not really well defined, right? And it's different for everybody, and it was different for me. So I can't say that, and even as a healthcare provider who specializes in supporting people who are going through these life changes and all these things, I support people when they come to me with specific issues, right? They're having functional issues. So the things that I support people with is they're having pain with something or they're having trouble doing something. And if it's related to pelvic health, sexual wellness during perimenopause, it's going to be bodily function. So pain or problems with peeing, pooping, sex, all those kind of things, right? Sleeping, right? Because sleeping is a big one as well. And so people are going to come to me with generally one or more, because there's often a lot of people, and it goes through different phases depending on the person. And certainly when hormones fluctuate, which is what we know is what's happening, right? The estrogen is just kind of jumping all over the board, and then progesterone and then testosterone don't really know how to behave because they're directly related to the flow and the cycle of estrogen. That's how they know to kick in and start working and start activating. So the hormones are all kind of confused. They're going through this fluctuation, makes people confused a little bit, makes our symptoms, makes everything. So I don't know, it's kind of hard to say exactly how, when I knew. It was actually very, very challenging. I just kept dealing with symptom after symptom, and I was trying, because I'm a extremely holistic person. I try to intervene, like do as little as possible, try to stay as organic as possible, and then kind of go through the chain of events, right? So if I can change something with my diet, with my movement, with something natural, that's what I'm going to do before I have to go to do other things. And at this stage also, I've done so many things personally, and I'm proud to say that I am doing hormonal supplementation and I am taking supplements as well. And I do need those things in order to feel the best I can at this time in my life, because I've done all the other things and I continue to do all the other things.
I want to do give you lots of credit for mentioning the sort of that definition of peri and definition of menopause, because I think that is almost like a starting point of confusion for many people, right? So I think understanding that peri actually can, be with us for 10 to 15 years until they reach that, to your point, that one day of menopause. It's a quite long time if we're not doing anything about it or being in the dark, right? The second point that you made, which was about holistic. So what we also learned through working on NABI is that it's, yes, hormone is fluctuating and doing things, but it's not like one thing is gonna fix you all, right? So there are many things that you have to do. You have to eat right, you have to move right, and you have to do other things. So the holistic approach, I think, is really important. But today it's really about, kind of tapping your expertise around pelvic health. And we know how important that is. Again, it's one of those things that, like, in my 20s and 30s, I really didn't think about it. But now I'm hearing a lot more about it. So can you start by explaining the basic of pelvic health and why is it so important, especially, well, for women and especially women in peri?
Well, certainly the pelvic bowl, right? It's the base of all of our function, right? And all of the muscles, the organs, that's kind of where women and, men have a pelvic bowl too, but we're talking about women and peri now. But that's where all of our power comes from. That's our base of support. That's where we can have life come out of us. We can keep things inside of us. It's where we have a lot of control of a lot of things. It's our muscles in our pelvis, it's our muscles in our abdomen, our muscles in our back. It's lots and lots of ligaments, and it's lots of things then connected to our hips, our glutes, our spine. It's connected to all the major movers in our body, right? And a lot of the things, again, a lot of our receptors, our estrogen receptors, are in our pelvis, right? In the clitoris area, in our ligaments and things like that. So when we are starting perimenopause and our hormones are fluctuating, the hormone receptors in our bodies are also getting confused and not really sure what to do. So a lot of things change, right? Especially regarding sexual wellness, right? Libido can change, and also our ability to lubricate, because it's dependent on estrogen in our body. And so you can go from having, like, as far as your sexual wellness, having a drive, which is, and everybody's drive is different, normal, right? But you can go for having your drive in your 20s and your 30s, and then all of a sudden your libido and your drive can change. And that gives everybody, it's like, not even like the stoplight goes from green to yellow, all of a sudden it's just a red flashing light, and you don't even know what hit you, and nobody knows what hit you. And it will affect yourself and also your community and your life, right? If your partner, your children, your family. So this is an issue that if you're going to go through all of a sudden this dramatic change, or even as it comes on and you feel the changes and not even know what's going on or how to address it, it can cause significant changes in the way you function overall, right? So, and I think that it's important, especially sexual wellness and pelvic wellness. Do you know what I'm going to ask you, Marina and EJ, since you're on right now, and anybody else who wants to answer, do you know what the optimal number of orgasms a person should have for their wellness? A person of sexual maturity. So after you've gone through, gotten your period, after you've sexually matured, until the day you die, do you know what the best number, optimal number of orgasms to optimize your health is? What do you think?
Is this like a weekly number, daily number, yearly?
We can say week. I like the way you think, Marina. How many orgasms a day in order to be healthy?
Well, I would be depressed by this answer.
I think we should ask people to, like, put numbers.
Let's put numbers there, because
anybody
I'm
who's
intrigued.
listening, how many orgasms do you think that one should have per week? And again, this is for male and female, in order to optimize their wellness and optimize
Five
their,
a week.
not just their sexual health, but their wellness
Heather
overall.
too. Five.
Too, Heather.
We're feeling 5. 5 a week.
Okay, 5 a week. Okay, let me see some other numbers. EJ, what did you think?
I said 5.
Okay, Tara saying 2 to 3.
Anyone else? Make a guess. We're not asking about today. What do you, the ideal world?
No, but actually, so the recommendations in order to optimize your health and wellness, because having an orgasm let's just talk about it not sexually. Let's just talk about it mechanically, right? Your muscles in your pelvic floor, everything, they contract, they relax. Blood flow, circulation goes to the area. It actually goes up into all of the chemicals, the endorphins, the serotonin, the oxytocin, all the things that release in your brain. So it affects a lot of our systems. So, and of course the pleasure center, but that's another bonus side effect. But all of those things, so medically, like statistically, they say you should have a minimum or an average of 2 orgasms a week just to keep optimal health. And it's not saying that you have to have a partner or intercourse or anything like that. It's just having the muscles like contract, relax, and having an orgasm. Yeah.
I feel like we need to give Tara like a prize.
I think we need to, yeah, Tara gets a prize. And then Marina, we need to get some advice from her because she really, she sets the bar high. But again, everyone is different, right? We all have different libidos. We all have different drives. For me, it's a different number. But, you know, I'm just talking about averages. And, you know, I hate to use the word, but we always use the word norms and normal. And the thing is, there really is nothing normal, but we want to look at just overall, like, you know, what the research says. And that's what the research shows, that everyone, and I'm not even talking about when you're in your 30s, your 40s, when you're in your 50s, your 60s, your 70s, at those ages, it's still actually important for your pelvic floor muscles to contract and relax. When you're in your 80s, keep going, right?
Wow.
So, exactly. So it gives us a lot to look forward to, ladies.
Wow, I'm like 80s, what?
Yes.
I'm like current baseline to 80s, just it's hard to imagine. But I want to ask you a quick question about the pelvic and the patients that you see in perimenopause. Is there a difference between somebody who had babies versus who didn't, but in peri, when you're looking at their pelvic situation?
That's a really great question, EJ. I like that question. And so, I mean, there is a difference in people's pelvises if they do deliver a baby vaginally and if they don't, right? And again, people who have babies, who have delivered children, it depends because now so many people have C-sections. Some people have VBACs, they'll deliver vaginally and they'll have C-sections. And so I have to say, I know you really want an answer for this, but just like a cat, right? If I say, EJ, what's a cat look like? There's all different kinds of cats, right? There's black cats, there's white cats, there's long-haired cats, there's short-haired cats. Some have stripes, some have spots, some have blue eyes, some have brown eyes. Have you ever seen 2 cats that look exactly alike? Very, very rare, right? Even breeds that are like normalized and standard, they look pretty similar, right? But they're all going to look a little different unless they're identical twins. And then they still may look a little different. But the same thing with pelvises. So whether a woman has given birth or not given birth, there actually can be a little bit of a difference in menopause, after menopause, and not, just because of the lubrication and the dryness. And just kind of like, for lack of a better word, the plumpness, because estrogen gives us that, they might sound like strange words, but it gives us our juiciness, our thickness, our suppleness to the area. And so somebody who does not have estrogen and is not supplementing with estrogen, the area is going to thin a little bit generally, and it won't make as much moisture or lubrication. So those are the main differences. But also, somebody who has given birth and who hasn't delivered a baby, generally the pelvises are slightly different, but not to the untrained eye, or not noticeably, because we do have that flexibility and resilience. I mean, the pelvis dilates, the muscles stretch, and then they also should go back and then should get strong again in order to support the pelvis. So there actually isn't a huge difference, but there is certainly a difference in somebody that's had a C-section. The scarring and those things, it could or could not leave a difference in someone's pelvis.
We have a question. Yeah, we have a question. So I'll take advantage of your pause. But
Sure.
Shanae is asking, she says she has fibromyalgia and she just started pelvic floor physical therapy, and she's hoping to get any good exercises to do at home.
So we're definitely gonna have a session about that. Like, we're not gonna let Rachel go until she gives some like practical daily exercises. So I mean, we can address this now, Rachel, or do you want to do it in a bit?
I mean, we can do whether I can answer a question. So first of all, Sinai, congratulations. I'm so proud of you for taking that step and starting pelvic floor therapy, because it can be kind of a, scary thing to some people, because people don't realize that physical therapists actually do treat you from the outside in and the inside out. And especially when you're having pain or fibromyalgia and other concurrent things going on, it can be hard just to live a day when you have fibromyalgia, let alone stick to appointments and be on a path to your own, to taking back and enabling your wellness. So congratulations. And I'm so happy for you that you're starting this journey. And the thing also, we're going to talk about a couple general things, because there are with excuse me, with menopause, there are some oh, you're welcome. I'm really like, from my heart to yours, like, keep going. And I hope that you have a really supportive therapist and that you are going to find success. And if you don't find success with the therapist that you're with now, find another one that you feel comfortable and safe with, and you'll be in really good hands, because physical therapy and pelvic health therapy, as part of the picture for wellness, is very, very good, supportive, holistic care. And I can't say that enough. And if you're not with the right person and it's not the right connection, because it is about the engagement, the relationship, then make sure you keep finding somebody new until you find that connection and you find somebody that is supporting your wellness in the way that you need it best. Okay. So anyway, with that being said, yes. So fibromyalgia, everything. If I can't look at Shanae or even just visually see her or put my hands on her, she's, again, fibromyalgia. People feel different with fibromyalgia. They can have different problems, different things going on with their pelvic floor. So in order for me to give her specific advice, especially with her complexity going on, I would need to do either an examination and evaluation, either live in my office or through Zoom. And I don't think this is the platform, because then I would need to look at her pelvic floor. So we're not going to do that today. But again, in general, there are a few things that are common problems and common pains that we get with perimenopause and menopause. And we can talk about those later. And we can talk about just one great thing, a functional thing for everybody that can be really helpful. But, if you do have a specific problem, you want to be able to get specific care for you as a whole. And it's not just, oh, my fibromyalgia, my perimenopause. Have you had any surgeries? Are you taking any medications? Do you have any kind of trauma history that we need to know about? What other, conditions do you have? What medications are you on? What is your health like? What is your diet and nutrition like? And we need to look at people and really get a thorough intake in order to be able to give specific advice to help them specifically. And one of the things I need to do, besides listening to people with my ears, I need to see them with my eyes, see them move, and I need to touch them with, these are extensions of my heart. I use my heart through my hands and I feel their body in order to feel what's too tight, what's too loose, and what I can help to facilitate making better. And it's different for every person every time. Mm-hmm.
I think that's interesting, because I was going to ask, like, is there some kind of a way for us to know, oh yeah, you're tight, or there's certain things that we can do on a daily basis. Like, if you cannot do XYZ, then you probably need to think about pelvic health.
Yeah. So again, the things that I tell people to do is, let's look at, like, yeah, you know what? Everybody's a little tight somewhere, right? I mean, can everybody put both ankles behind their head? Raise your hand if you can, right? Well, your ankles, EJ. No. But you know what the thing is, though? I have extremely loose connective tissue. I can put my ankles behind my head, and I still have tightness in certain areas. And so everybody's consistency, there are some people that are just genetically and structurally, because of the collagen and their genetics, tighter than others. And there are some people that are looser, right? I say this, not everyone, no matter how hard you work, not everyone can have a body like back in the day Arnold Schwarzenegger did. And no matter how flexible you try to become, not everyone could become a Cirque du Soleil performer. If you're going to be one of those two things and really be at that advanced level, you have to have a genetic, a structural, a collagenous difference compared to other people. Now, we can work and we can remodel things, but our structure is our structure, and we have to take that into account as well, right? Some people are just a little bit more flexible than others, but we can still find balance even within our own rails of what our flexibility and our strength is for us, right?
Yeah, and this is kind of obvious, but like now that we hear about the pelvic health and like what role it plays and why it's important, but I want to connect that pelvic health with sexual wellness.
Sure, sure.
So that's
So again, to get back to what you asked, so how do you know if you need physical therapy or pelvic health therapy? You have a problem. Generally, people come to me with a problem, okay? They are going to tell me, I have, oh, and let me ask you this question. One more, I'm going to quiz everybody again. How often should you have pain with intercourse? How often? Well, like what percent of the time is it normal to have pain with intercourse?
Never, ideally, I guess.
Never. That's the only answer. Never, ever, ever. Okay. It is never. So if you're having pain with intercourse, that's sexual wellness, right? If you're having low libido, low desire, you're having relationship issues because of whether it's pain, desire, ability to lubricate, those kind of things, right? If your pelvic floor muscles are too tight, right? When things get traumatized and they get whatever, they can tighten up and resist. So maybe your pelvic floor muscles are too tight. So you're having pain because it's giving resistance. Maybe, and again, we all talk about it's in fashion to say, oh, we have to loosen our pelvic floor, it's too tight, or we have to do Kegels, strengthen, strengthen, strengthen. But that's not really it. It's about the balance. We want to optimize the balance between strengthening and loosening. And in order to do that, a therapist or a professional needs to really assess to see what's going on. Because in general, there are some areas that are going to be too loose, and there are some areas that are going to be too tight. And we have to figure out which ones are which and then be able to engage them all in order to restore balance and health. Okay. So people come to me, why would you come for pelvic floor therapy or for sexual wellness or anything? I think Marina, you touched on it before, incontinence issues, pee and or poop. Okay. Or we can talk with those words today, right? So yeah. Urination, defecation. I mean, I went to Columbia, but I hate, some people are all about using the proper words, using the proper anatomical words. I'm okay with saying vagina, vulva, penis, but I'm also okay with saying like, whatever you want to call it, I don't care, as long as we know what we're talking about, right? So we can use the anatomical words and we can also use the common lay words, because I'm not here to impress you by saying urethra, So again, incontinence, which means not being able to keep your liquids inside of you, liquids being pee and poop, okay? So if you, Marina, talk about some things. You were saying you're having sneeze, so you want to talk about sneezing issues, right?
Well, you know how, you sneeze, and sometimes you're like, okay, I'm glad that I'm wearing a liner because, you have a little accident, if you're laughing too hard. And it's just like, it doesn't happen as often as when I had my kids, because I've been able to, just recover that strength in my muscles and tissue. But still, sometimes it happens, and you really become aware of the need to, just like work out that area.
Mm-hmm. Well, I want to tell you something, Marina. It's not normal. You should, how you should be able to sneeze, jump, laugh, pick up your kids, do a squat, do all of those things. It's about pressure management. And I want to tell you, I know that the industry has normalized things, but wearing a liner in your underpants, it's not normal. Okay. I don't care if you're done being potty trained, right? And you can go and you don't have to wear diapers anymore. Up until the day where you don't even have to wear underpants anymore, all the ages, once you have achieved full functional control of your bladder and your bowel, you should not have to wear a liner. It is not normal. Now, do we go through things in our lives where we have different events, traumas, different things that cause us, right? Childbirth, if you've delivered vaginally, you don't even have any idea of what control, how to do it. It takes some time to get those things back. But we do have the capacity and the resilience to be able to live our lives at the age of 60, 70, 80, 90 without peeing our pants or pooping our pants. And the thing is, our society in America, we have normalized it so much. Oh, put a liner in. Oh, go get those Depends or whatever it is. No, do something about it. There's, to reference it, I will reference it if you need another time. They had a study going on in a nursing home, right? And they had, I think, you know, and again, I'm not giving the right numbers because I don't remember the study. It just came from the back of my head somewhere. And it was like 75% of its residents were incontinent. They were wearing diapers, they were being changed, whatever it is. They put as a trial these residents on a bladder training program. They stopped putting them in underpants, you know, diapers, and they started putting them on a toileting schedule, which is, do you know what's normal going to the toilet during the day? What do you think is what should we do with going to the toilet with bladder control during the day? What do you think is normal?
10 times.
10 times. Okay. How many times a day, EJ?
I don't know, 5.
Okay. Anybody else?
6.
Heather, 6. Okay.
Tara, you gotta have the answer, I think.
I'd say 12 if you're hydrating properly.
Hydrating properly. That's a big, big topic these days, right? Hydration. Everybody get your giant thermos to carry around all day long so you can lift weights and hydrate all day long, right? You know what? What do you say, Tara?
No, I'd say 12.
12. Okay. So it's really interesting. So we don't want to overdo it or underdo it. We want to have appropriate hydration. It is extremely important. And I'll give you some averages. So on average, you should go, your body should tell you, you have to pee, and you should pee once every 2 to 3 hours during your waking hours only. Okay. So once every 2 to 3 hours while you're awake, okay, is how often you should be. And when you're peeing, you should have a nice flow, at least 8 seconds, and your urine, unless you're taking supplements or something in your diet, it should be almost clear. And now I know hydration is a hot topic these days, right? We are like all about like the fancy waters, there you go, put salt in it. There's so many different things that we could go into with hydration, but drinking water is really a wonderful thing to do. And if you choose to supplement because it serves you in a way with other things for hydration, so be it. But actually really an interesting measure, like, you know, they used to say 8 glasses of water a day, but no, that's not really good. So what a really great way to know, and again, on an average day, you're not outside in 90 degrees running a marathon, you're not doing anything like that. On an average day, hydration, a great measure for hydration is if you take about half your body weight, okay, in ounces. So if you weigh 100 pounds, for example, you should be drinking about 50 ounces of water or hydration per day. And that way you can really know, because, you know, 100-pound person and a 210-pound person, they need different numbers of hydration for sure, because they have different cellular mass and different things going on in their body. So on average, we want to take about half of our, half of our body weight in ounces. And that's how you know you're appropriately hydrating. And with that, you should be going to the bathroom, because your body tells you to, once every 2 to 3 hours during your waking hours. And also, how many times should we get up and pee at night? That's right. 0. 0, 0, 0. Now, if you have earned the honor of the maturity of being Medicare age or older, 65 or older, 1 time you're allowed to if you have to. So it's 0 to 1 when you've reached that level of maturity. But below that age, from the time that you've become toilet trained until you're really well into your 60s, you should be peeing 0 times a night. That's normal. So how many times a night? EJ, I saw your face. How many times are you peeing a night?
No, I'm actually worried about my partner. So I think there's some things up. I think even he knows, because I've actually told him to get checked, but does pee quite often in the nighttime. So I guess what you're saying is, if it's like you shouldn't, when you're sleeping. So that kind of concerns me. Yeah,
interesting. And you know what, if you want to talk further about that, you know, privately, I'm happy to talk further about, because I'm going to have some more questions right away. I want to ask you 10 questions about your partner to see, like, maybe if we can figure out what's going on. A lot of times it can be behavioral, but there can be some medical things that can be going on. And it's, I don't know, can you just, I think you said it was a he. Can you tell me about how old he is?
He's 59.
Yeah. So a big thing that we want to look at in our 50s is the health of the prostate as well. And so that's something to make sure of, and to think what's going on again. And with, if, especially if it's something that starts early. So that's something that you definitely do want to explore more. And if you want to talk to me privately, again, I'm not a urologist, but I could do like a general screen to kind of steer you in a better direction. Again, and then for me, I don't like to go outside the scope of my expertise, but I definitely can be an early screener. And in our practice, I know we're talking about perimenopause, which is going to be people with vaginas, but we treat all genders, all things. So we treat a lot of people with prostate, urinary incontinence, erectile dysfunction. So men have sexual health and wellness issues as well for a lot of different reasons. And we treat, you know, we treat anybody who has a body in our practice, actually.
Yeah, I think this is so interesting how like we talk about what we're going through perimenopause. It's like a taboo conversation, but if you look at actually men's health, I know that's not the purpose of today's conversation, but you know, they also have a good amount of taboo subjects that they're dealing with.
For sure.
But I want to bring it back to sort of pelvic empowerment in perimenopause. So was wondering maybe we can talk a little bit more about sort of strategies and exercises that, again, we're not being specific to any situation. So it's more like general recommendations or suggestions that people can pick up on a daily basis, something that you can try. So was wondering if you could kind of either show us or recommend certain moves that we might be able to just try as a starter.
Sure. So I think as far as pelvic empowerment so when I think of pelvic empowerment, I think of it from like a deep, like a subconscious level, because my pelvic empowerment comes from deep within, and then it manifests as a physical expression, right? And then there's also the power, the strength of the pelvis, which is also very important. So one of the things, and let's talk about strength and balance, like what we can do to stabilize ourselves and really get good power. And because we'll talk about the things that I was alluding to before, two of the common physical problems that a lot of women face as they're in peri and into menopause is they get hip pain and problems and shoulder pain and problems. Marina, are you raising your hand because you identify with something like that?
Yeah, hip pain, joint pain. Yeah.
And so hip pain and shoulder pain and frozen shoulder is a common thing. And if those are things that you're in your mid 30s into your 40s and you're starting to have things like that, that also starts to say, well, is this also a hormonal contribution? Is this a perimenopause thing? And the answer is probably yes. It does all work together. It's, you know, obviously if you walked across the street and got hit by a bus and your shoulder hurts, then we know that's the problem. But if it's just something that's kind of creeping on and getting worse and worse, it's extremely common. So one of the things that I like to teach, and a lot of people, to get their power and their strength, again, it's about balancing flexibility, mobility. But one of the wonderful activities that I think is helpful for almost everybody, and it doesn't matter how inflexible, how weak, or how everything, is mastering a squat, a basic squat. And the other thing then people are going to say is, oh, but my knees. No buts. Everyone should and can be able to do a squat. Okay. So if you have legs and a pelvis, then, and even if you don't have the legs that you're born with and you have a prosthesis, you can still do a squat and master a squat. Okay. So one of the things that I think is super important, because bless you, one of the things that's important these days, because one of the things for negotiating and navigating this stage of our life is weight-bearing activities, right? And right now, especially, and it's a great thing, strength training. Strength training is hot because using weights, using our muscles, movement medicine is so paramount in any stage, but especially this stage of our life. But not only is it important to load up and do weight-bearing exercises, but it's important to have the mobility and flexibility in order to go through the range of motion, right? So you can't compromise one for the other. You have to be able to do both. So I feel that while your goals, maybe you want to squat, I don't know, 50 pounds, 100 pounds, I don't know what your goal is if you have one, you have to be able to do it with really good form, okay? And does anybody know, or can anybody let me know what you think? In order for something to count as a squat, what has to happen? Heather, that's great. Your knees do have to bend. That is one of the things that has to happen. That's absolutely true. I love that. Yes. Anybody else? What has to happen in order? But bending your knees isn't the only thing that constitutes it. It's very clearly defined in order for it to count as a squat. So we're on the right path. Tara,
For sure.
I love you. I hope you're in New York and come for some physical therapy. Tara said it has to hurt. No, it actually, guess what? It shouldn't hurt. None of these things should hurt. Sex shouldn't hurt. Going for physical therapy shouldn't hurt. Exercising shouldn't hurt. We should feel that we're exerting ourselves and we're getting strong and empowered, but it shouldn't hurt. Marina, you got this. Your butt has to go lower. Your butt is parallel to the ground. That's a good one too, right? Your hips have to go lower than your knees, okay? And I'll tell you, that is something that for a lot of people, it takes some time just to be able to accomplish that, to get the availability in their pelvic floor, in their inner thigh muscles, the groin muscles. I can be really fancy, the adductor magnus, in your hamstrings. And also, interestingly enough, one of the things that a lot of people don't think about is you need flexibility in your ankles as well to get a good squat in, because you have to have that mobility all throughout the chain. So it's your hip, your knees, your ankles, and your balance and stability. And again, your glutes, your butt does need to go below your knees for it to count as a squat. And I really encourage a lot. That's one of the things I look at when people come to me with any kind of pelvic dysfunction, pelvic imbalance, or sexual dysfunction. I say, do a squat for me. And that tells me a lot of information to show me which things are working too hard, which things aren't working well enough. And I look front to back, left to right, and top to bottom as well. It's very, very important. Yep. So again, practicing getting a good squat is a great thing. And a good thing that I do, and I don't know if I stand up, if you're not going to see me all the way, but a great way that I start people who really say, oh, but it has to hurt, or my knees hurt too much, I can't squat, I haven't done anything like that. And we're all going to start at our own level. But what I do with people is I get them to a stable chair, a stable surface. You get your legs about chair legs separated apart, right? So you want to separate your feet about the width of the legs of a chair. And what you want to do is be able to keep your back of your legs close to the chair, be able to bend your butt and sit back. A virtual group squat. Yeah, we can do it right now for sure. We'll all get up, we'll all look at our middle. And again, you're going to be against a chair. Hopefully it doesn't have wheels. Mine doesn't. I'm going to be careful. You're going to keep the back of your legs touching your chair. Your feet are about hip distance apart. And then very slowly, you want to bend your knees and you want to hinge. You don't want to bend at your back. You want to keep your chest upright and your eyes upright. And you want to stick your butt way back in the chair, nice and controlled while bending your knees. Good. So Marina, I saw you kind of plop at the end there a little bit. You want to be able to get down controlled. Oh, I saw it again. So Marina, that's a good place for you to start working. EJ, you looked great in your squat, actually. I can't see anybody else's video or his face on the screen, but if anybody wants to show me, I'm happy to critique your squat a little bit. Okay, Heather plopped, but she won't show us. Come on, Heather, show us. We want to see.
Like how many do you recommend that we try to do? Because that's something that you don't have to really go to the gym for it. You could do it in while you're doing whatever at home or whatnot, or even just waiting for the train.
Exactly. Listen, yeah, right. Exactly. Listen, I go to the gym. I'm an advocate for the gym. I also go to yoga. I also do outdoor sports. I think variety is the spice of life, but no, a lot of people don't have the time, the energy, and yep, easily at home. That's right. Exactly. And so again, how many do I recommend? Sorry, I have a hair in my mouth. Excuse me. So you want to do a few, and I think, I actually read a study recently, because you know how they say, oh, people say all these crazy things because of apps and whatever. Oh, walk 10,000 steps a day, or walk 30 minutes here, or do that for up. First of all, those are just things that are arbitrarily made up. But some research has come out that it said even if taking every 45 minutes, because sitting, as we know, what is sitting? The new smoking. It's the worst thing that we can do, and we're doing it all day long. We're on our phones with our necks down. It's bad for our pelvis, bad for our bodies, bad for everything in a lot of ways. So now a study came out that I can reference, and it said every 45 minutes, you get up and you do about 45 seconds of squat breaks throughout the day. And that's better than going for what people are saying now, 30-minute walks or this 10,000 steps or anything like that. If you just do 45-second squat breaks throughout your workday out of your chair, that's actually better to optimize your health overall. So, yep. And again, it doesn't have to be like we want to all work within our capacity. So if doing one is challenging for you, try one, and then later on in the day, try one more. And what we want to do is we want to get it controlled that we can get into the chair and then out of the chair. And then you want to continue doing it. You want to lower your chair. Then I use something like a yoga block or a stack of books, and you want to just kind of progress safely, lower and lower and lower until you can get that squat without anything beneath you, and you can go up and down in that weight bearing. And then that's when you're going to start to really add in weights and things like that.
Got it. But
Yeah.
so time check. I just want one more. If you have to give us a squat and one more, what would be the one more we could do on a daily basis?
On a daily basis? Well, so one thing, so let's just talk about, oh, sorry, I'm going to adjust myself in my seat, excuse me. So let's talk about pelvic empowerment in a different way, right? So we talked about structurally how we can do an exercise to actually strengthen and move our pelvis in certain ways. For me, a big part of it and our libido, our mindset, like all of those things are a huge contributor. And so one of the things that I like to do is even some simple breath work and putting myself consciously in a place, like it's where you talk consciously is what gets subconsciously and goes into your system so that really the empowerment can happen. Because I could talk about all day long, like, oh, I love my pelvis feels great, whatever, that's conscious, but we have to repeat it and get it to a much deeper place so that we actually feel it authentically. And so one of the things I love to do, and if everybody who's sitting wants to do it with me, what I want you to do is just take a deep breath and inhale into your pelvis. So most people, when they inhale into their chest and shoulders here, right? That's not what I'm looking for, okay? I'm looking for, and you'll watch me, I'm gonna inhale, and you're not gonna see it on screen right now because I'm inhaling, I'm filling my belly nice and big and wide, and I'm filling my hips and my seat with air. So go ahead and take a deep, low breath and fill your pelvis and hips and your seat with air. And hold it. Keep holding it. And now just naturally let it go. Keep letting it go. And then as if you're blowing out birthday candles on your birthday, exhale all the way, all the way. Good. Inhale, take a deep breath. And I want you to close your eyes now. And I want you to see your pelvis, love your pelvis, see the happiness inside your pelvis. Hold that breath. Let it out naturally. And then gently blow all of the air, any pain, any resistance, any negativity out of your pelvis. One more time. This time, take a big, deep, low breath. Fill your pelvis with love. Fill it with sensuality. Fill it with libido. Fill it with power and hold. Hold all that power in your pelvis. Gently and organically let the exhale happen, exhaling out any kind of doubt, any kind of negativity. And then through your lips, fully exhale, engage, and let out anything that doesn't serve. Beautiful. How did that feel?
Feels like a different person here. Feels
Amazing.
great. Yeah. Thank you for that.
I'm seeing amazing.
Yeah.
Oh, you're welcome. You're welcome. I started to do it, and then as I'm guiding through some guided visualization. Oh, I love that. Wonderful. Great visualization. But remember, it's not just visualization. We want to visualize here. I like to actually roll my eyeballs back, visualize and see it inside, because you really want to set it and reset those neural pathways on in an extremely deep place. So it even gets back into our subconscious to actually make change, because we do have the capacity to make change from things like visualization if we do get it deep inside of us. Mm-hmm.
This is the holistic side of you that obviously like I'm loving, right? And I think when we talk about perimenopause, that's biology. It happens to all women in mid 30s to, all the way to, early 50-ish. And there are things that it's a psychological, physical. So I love your approach, that holistic approach, pretty much aligned with how we think about Peri and Navi, and also the way we just trying to let other women think about it as well. It's not about the physical, it's like the psychological as much as physical combination. So there are things that, like in terms of exercise, what you just show us is like very simple, easy to do on our own. We don't have to go anywhere, but it's also just really promise to ourselves to like practice little dose throughout the day. Then hopefully we're being, better, version than us not trying it, So thank you.
Listen, when you start somewhere, you go great places, right? But you have to start somewhere, and it doesn't matter where you start. And interestingly enough, you can start with little simple things. And then also I treat people, for anybody that's in New York, I treat people one-on-one. And I also do these pelvic empowerment and sexual wellness circles. And I do have my next one coming up in October. And I know one of the great things, because again, one of the supplements I do take are your supplements, which I have to say, I know we've had these conversations, but they have been such a beautiful addition to my overall optimization of wellness. I feel different since taking your supplements. So I want to thank both of you very much. I can't speak for what it'll do for anybody else. And I know that I definitely do a lot of different things, but since I started taking your supplements, I do feel different. And I'm really, really grateful for that. And part of the picture, again, as a whole, I do these sexual and pelvic empowerment workshops. And our next one is going to be held, I'm partnering with this chiropractor in Spine Health. And we're going to do it in her space by Columbus Circle on Thursday, October 25th, I believe it is, at 6:30 p.m. And I'm putting it out there for anybody to pre-register now. We do very intimate workshops. It's at maximum 20 people. And we're going to be really going deep in it. We get together a community for the night. We do some anatomy and different talks about that. And then we do some practices and a lot of collaboration. And I bring all of my different things, because this is going to be a sexual wellness workshop. So I bring all the pelvic dilators and the wands, and we have really, 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 really a lot of fun in the workshop. And we really talk about things that we can all do, and really share our stories about how to optimize ourselves and the things that we're going through in our pelvis. And it's always a really beautiful event. It's a few hours. And so the next one is in New York City. So anybody who's seeing this, if they want to pre-register, they can reach out like through you or through me, and we can get you pre-registered for those, because it's a great couple of hours and a pretty inexpensive way to get a lot of experienced, legitimate healthcare providers that are going to steer you in the right direction, because that's really helpful. Because today, what's out there, sometimes there's a lot of misinformation, a lot of confusion, because we have a lot of people saying a lot of things that are just simply not true. So I think it's very important to have personalized, holistic, individualized care, and to make sure you're getting it from a qualified person who knows what they're talking about.
Amazing. Well, thank you so much for that. And then also thanks for the plug on Nabi. Before closing, I just want to make sure that everyone, questions for Rachel? I mean, please, let's take advantage of this time. Anyone? It's a safe environment. You give 3 seconds.
Okay. I want to thank you both.
Heather
Thank
is loving you.
I'm sorry?
Heather is loving you.
Oh, Heather, I really appreciate you so much too. I hope you got something out of this, and I hope that you are able to empower yourself and just be the best version of yourself that you can be, because that's all we can do every day, right? And the next day to try to do even better, I think.
Thank you so much for the real talk and, sharing all the tips. And again, we walk away with something that we can do, which is really good, really helpful.
Right.
And thank everybody for joining. I'm sorry, last word.
Do your squats if it feels right for you. And if it doesn't feel right, please don't do it. We don't want to go. I think one person hopefully jokingly said it has to hurt. I never encourage people to go into pain. It has to be therapeutic. I call things delicious pain. And so make sure it feels delicious when you're doing it. If it just hurts, then definitely don't do it.
I love that. I'm just gonna write it, the delicious pain. All right. Well, wonderful, wonderful conversation today. Thank you, Rachel. Thank you, everybody who made this conversation really fun as well. Wish you a great rest of your week. Bye, guys. Hope to see you again.
Thank you.
Thank you. Thank you.
Bye.